hospital health systems and medical practices, healthcare providers must evolve to meet these changing needs to remain competitive or risk falling behind. There's only a small percentage of care agencies that is using this method. And there's a way of doing it. Like I said, you don't want to be sleazy, you don't want to be pushy, you want to be compassionate, take your time, trustworthy, and really connect with people first so that you get to understand who they are. Because when you pick up the phone and you call a care home, for example, they don't know who you are. You don't know who they are. You don't know, what they look like, what they like, who they are, for example. Whereas on social media, you can get to look at who your perfect avatar is, who your client is, and then you can then search for them as well. As more healthcare professionals provide accessible online services and shorten the red tape between physician-patient communication, consumers no longer feel the need to visit closest options. Instead, they're empowered to choose a healthcare business offering a consumer experience that meets or exceeds their expectation. And this can also involve private clients that want agencies that are looking for either personal assistants who are self-employed or healthcare assistants, for example, to help them in their own homes, for example. Okay, so this is why the social media is a good way, because it's like you're there, but there can be like a boundary, okay, and it's about you not crossing that boundary with individuals because it is their private space as well. So you have to use a certain methodology in order for it to be a successful outcome for the patient, for the organization that would use you as a supplier. So healthcare marketing can't happen without a planned healthcare marketing strategy. To keep your healthcare brand at the forefront of people's minds, think of all the reasons someone might decide to switch healthcare providers, because everyone's got a choice of who they use. So they may want to come to you instead. So we have our program, which is the Millionaire Healthcare Business Mentor Program. It is the Advanced University of Care Providers. We've got the beginners, but this is advanced. This is for business owners, not beginners, that are in their healthcare business that are struggling to get past. They could be at a level where they're doing 500 hours, for example, a week. Some are doing more. For example, we have people that are, doing 3-4 million, for example, and they want to go onto this program. So I just wanted to mention that this is not for beginners. We have got boot camps which are for beginners as well, and we have dates on that as well. But today I'm talking to you about the Clinical Marketing Wealth Program, and this is where I teach you the methodology, I teach you the structures, I teach you the way and the scripts, how to communicate from a healthcare provider, supplier point of view to a potential buyer who is a client. So this is why this program has been created, because no one is doing this in the healthcare market. And this is something which I've been trying out for some of my clients as well. And we are a global company. So we've got the UK, we've got Cyprus, and we've got the United States of America as well. Okay, so it's not just the UK, it is everywhere. Communication isn't being done in this way to get business. It's only It's only the organizations that are at, say, 10 million and more that are using this, apart from the clients that I've been training, as well as ourselves. We offer the marketing program, but we also offer the done for you, where we do the service for you. But this takes 3 months to build up a relationship. It's not instant, okay? So you have to be aware of that. We have had clients, for example, one client in 8 weeks was able to double the number of hours that they were doing. So, for example, they were on 1,000 hours and they're now on 1,500 hours. So isn't that a positive for that client? And they use the same methods as what I'm talking to you about today. So the Clinical Marketing Wealth Program, we train you how to do this. It's a 12-week program. It's a 3-month program. And like I said, the client was able to increase in 8 weeks by 500 hours a week. Can you imagine what that can do for your business? They implemented the strategies. But we also offer the Clinical Marketing Wealth Program, where it's done for you, whereby we do it for you. But like I said, it takes time to build a relationship with organizations, but it does work, okay? It's not like the instant 7-day thing. It takes time to have a relationship, to get contracts and to build that relationship and that continuity. It will take about 6 to 8 weeks, for example, okay? However, it does work. And like I said, you as an organization need to look at different methods that you can use and different income streams that's going to create more revenue for your organization, but also client customer relationship satisfaction is going to be important as well.